Hello, my name is Adam Kirking. I'm the Director of Operational Performance and Analytics with Imperium Health. Today we will continue our discussion on at-risk and high-risk patients by focusing on a group of patients that we commonly refer to as our RED patients. Today's webinar will build off our earlier discussions of both risk and utilization. We're going to talk about the importance of identifying your patients, introduce the RED patient concept, as well as discuss how can we best support those patients. Part of best supporting those patients is identifying what community resources might be available to help, and it might also be what clinic-driven solutions we're able to provide to those patients. And then we're going to take away with a few action items for you as a practice or next steps for you. In our earlier discussions of high-risk or at-risk webinars, we've introduced the idea of some patients can be able to be identified as higher risk or at risk using claims data. Using that claims information, we were able to stratify or even group our patients into different levels of need. Through those earlier discussions, we also focused on developing internal processes to support beneficiaries that were maybe utilizing a component of healthcare differently than their peers, such as that patient that is more likely than their peers to go to the emergency department, and how to find the kind of why for what's going on with those patients and why they're going to the emergency department. Or those patients that have been chronically receiving home health services, and maybe receiving home health services that they don't necessarily qualify for. I'm certainly not arguing against any level of appropriate health care. This is just to ensure that every patient gets the care that they need and that they're eligible for. We've shown this slide before, and I really believe that the importance of focusing on our high and our at-risk patients is that this is a group of patients that's maybe utilizing healthcare differently than their peers. And while, yes, those patients are a little bit more expensive, this is also experiences that those patients are having to go through that we wish they maybe didn't have to. That if 5% of our patients are representing as much as 45% of our costs, or 10% of our patients are representing as much as 65% of our costs, they're utilizing healthcare services differently than their peers. And that might be an opportunity to provide different levels of care management, care support, to ensure that the patients are getting what they need to thrive. So really trying to focus on patient-specific care plans for those patients that are a little bit higher risk or at risk to ensure that they're able to get the care that they need. And as we've talked about high risk or at risk in the past, we've brought this up that it's not necessarily a reflection of empathy or skill of the team. I believe that every time I talk about high risk or at risk patients, I still need to come back to this, because this is not saying that the caregiver or the care team that allowed a patient to become high risk. That's not true at all. Some patients are just medically more challenging. Some patients are just a little bit trickier than others. And how we can engage those patients, how we can try and best support them, can be the real differentiator, supporting those high and at-risk patients and ensuring that we're able to position them to thrive as much as possible. Now, every patient is important. The benefit of being in the ACO, or one of the benefits of being in the ACO, is that we have access to extra claims data, extra information, that we can hopefully use that extra information to support our patients in different ways, things that we maybe didn't know about. And how can we, having that extra information, support our patients? And we've shown this slide or some variation of this slide before, but it really reflects the changing needs of every patient. And some patients are going to utilize healthcare differently than their peers, and that might be okay, but it also might be something that we have an opportunity to step in and try and develop a more patient-specific care plan. Now, I'll commonly refer to patients as the red, yellow, or green stratification. That doesn't necessarily mean that some patients are better or worse than others, but by putting the patients into these categories, it sometimes helps in terms of identifying care needs, goals, challenges, or even expectations for those patients. And as we've grouped our patients into almost different subsets, we're able to have more patient-specific care plans developed for them, because we've started to identify who is at maybe a little bit greater risk than others. So as we dig deeper into these patient subsets or these patient groupings, this isn't to say that any of this information will replace clinical judgment. This is just meant to sort of enhance the things that you are already doing as a provider while providing some patient-specific action items for you. So as we group those patients, I'll commonly refer to them as red, yellow, or green. So your green patients are the ones that are probably less likely to seek out healthcare. They probably have lower risk, but they might have rising risk. They probably have less chronic conditions, and I would definitely say they're more likely to have less documented chronic conditions. They may not actively seek out care from a PCP, but they might be one of those people that sees an ad on TV and feels like, you know what, I got to act on this. Engaging those green patients once or twice a year, even a little bit more often, is one of the best ways to ensure that we're able to stay connected with them, position that patient to thrive, but also keep that patient, in that kind of green or healthy status as much as possible. The next grouping of patients that we're going to talk about more today is the red patients. So those red patients are ones that are more likely to actively seek out healthcare or necessarily receive healthcare that they didn't seek out. They're going to have higher risks or more likely to have rising risks. They're going to have more chronic conditions, but even though they're going to have more chronic conditions, they still may have underdocumented chronic conditions. Just as complex as they are, we don't oftentimes think about slowing down to document on those patients that are so medically challenging. And they may or may not seek out care from a PCP. This could be a patient that is likely to go to the emergency department, but not necessarily likely to follow up with their PCP. So how can we engage this patient that is seeking out a lot of health care to come to the PCP, come to that really high value, well-connected setting? So as I'm looking to identify a red patient, or this patient that we feel like we can really focus on, the things that I'm very concerned with or want to really prioritize are patients that I feel like I can impact their utilization. That there's an opportunity to redirect care. Maybe it's a patient that's going to an an emergency department that we could redirect to a clinic visit. A patient that's receiving home health services that we could transition to chronic care management. Those potential for care alternatives is really the biggest win, because we want to try and bring those patients back to the clinic, back to those community resources that are going to be very high value, but also allow the patient to be connected within the healthcare system, reducing any potential silos or barriers that we might face. And identifying those community resources, from my experience, has been one of the best ways to extend your influence as a provider. Now, I will tell you that from my time at Imperium, working with very rural and very urban communities and very urban providers, as well as FQHCs to multi-specialty groups or employed practices, every community has access to different resources. Identifying those resources in your community can really help you as a caregiver to support the patient and ensure that the patient's getting the best outcomes possible. Because we know that you as a provider have limited time, limited number of opportunities to care for the patient. So if you can extend your influence by partnering with some of these local community resources, it can make a big difference. And not every community is necessarily going to have equal resources. Rather than focusing on the resources that you or your community maybe doesn't have, let's focus on what you do have. And identifying the resources might be as quick as a Google search. And I would say if you have any questions as you're digging into these resources more, please feel free to reach out to an Imperium team member, either myself, Adam Kirking, or someone else on the team. And this slide is really meant to highlight the different levels or different opportunities that might be available within your community. Some patients will really benefit from that extra set of eyes during the day, that adult daycare setting. Some patients or some people need a little bit more help around the house, but don't necessarily qualify for Medicare covered home health services. Before coming to Imperium, I worked for an ACO that we actually had our own palliative care director. Palliative care is kind of a unique skill, and some providers are able to do it on their own. Some providers want to outsource that. So if you have a provider in your community that is passionate about palliative care, feel free to make those referrals to that provider. Certainly that's a way to extend your care or kind of deflect care to somebody that might specialize in palliative care. Chronic care management can be a great way to reach out or connect with the patient when they're outside the clinic. And then oftentimes getting that appropriate nutrition can be so difficult for our patients. And anytime we can connect them with a home meal delivery system, that can not only provide the level of companionship that our seniors need, but it can also provide the appropriate nutrition that they're after. And while those community resources are incredible, and I would certainly say look to your community to try and find those community-specific resources that you have available to you. Other communities may not have that, or there's things that you're able to do internally. If you're able to extend the hours of your clinic or provide kind of resources or direct the patient towards an appropriate urgent care, that can be a great option. I will always promote trying to see, especially your more medically challenging patients, a little bit more often in the clinic. And if you're not able to have them come into the clinic, consider chronic care management as a way to extend your influences of the clinic through a nurse, through an MA, by having those chronic care management phone calls with the patient. Palliative care can be done either through a hospice organization or independently as you as a provider, and that ability to participate in those shared decision-making conversations. Undergo that advanced care planning. Ensure that the patient has the advanced directive. Ensure that they have not only the care plan that they need, but also the care that they need. So how can we then cater our care environment for the patient? Sometimes nutritional support, and this could be something that's even provided by an outside company that would be coming in, such as a pharmaceutical company is often willing to provide extra nutritionist support, or even disease management specific care plans, such as focusing on your patients that have diabetes as a diabetic clinic, or your patients with COPD as a COPD clinic, and bring those patients in either together or even one after another to ensure that you're really in that disease specific mentality for the day. Now, a couple other clinic services that we've already discussed that I still believe are very important are transitional care management, and that's that 7 or 14 day follow-up after a discharge with that within 2 business day interactive contact with the patient. TCMs are one of the best ways to reduce unnecessary readmissions by connecting with that patient, preventing those potential medication errors, and ensuring that the patient is able to thrive at home. We've talked several times about the importance of annual wellness visits and developing that personalized prevention plan. Now, I think one of the benefits of a wellness visit is it allows an opportunity to validate quality information, which might help us to find an A1C that's missing, or realize we hadn't tested an A1C or a colonoscopy in several years. It also helps to validate the patient's medical complexity. And by that, I mean it helps Medicare to understand how medically difficult the patient is. And the more codes, more information we're able to document on our patients, it can also make it easier to identify who are those higher risk patients. And the most important thing as I'm thinking about my red patients is engaging those patients. So that as we've looked to identify, okay, who are these patients, which levels of complexity do they fall into, the best thing we can do is once we've identified a group of patients we feel like we can work on, let's bring them into the clinic. Let's try and develop that really specific care plan using the extra data that we have available to us as an ACO. How can we take that information to really try and create a VIP experience for our patients? The more we can do to connect with our patients outside of the traditional 99213 is how we're able to make a difference or really connect with some patients in a different way. So next steps for you is Imperium Health will be likely communicating or sharing a red list with you or your practice. I'd like you to take that opportunity to review that list. Try and identify whether or not they're your patients, but when I say your patients, I mean let's pick the patients that you feel like you can have an influence on. If that patient moved 9 months ago and they're no longer seeking care in your clinic, that's fine. Let's pick the next one. If your list has 5 patients and you need the 6th patient, the 7th patient, great. Let's identify the patients that you feel like you can have the biggest influence on. And let's identify what potential care alternatives we can try and establish for those patients. Can we establish or modify our care plan that we already have for that patient using this new claims information, realizing that patient went to the emergency department out of market, realized that the patient had a home health order that was signed by someone else. And then how can we try and bring that patient back into the clinic or reach out to them through a really interactive phone call to discuss that revamped care plan and how we're able to best support that patient. Thank you very much for your time today. If you have any questions, please email me at adam.kirking@imperiumhealth.com. I hope you have a great rest of your day, and thank you for spending a little bit of time with me today.